Hello and welcome. I'm Dr. Alex Medhirish, and I'd like to talk about exosome therapies, in particular today, intranasal exosomes. All of our patients undergoing the 3-day mesenchymal stem cell and exosome IV treatments receive an intranasal nebulizer for the administration of exosomes, usually once they get home. Many of these parents also go on to request additional intranasal exosomes after 3 to 6 months in order to continue exosome administration. On the other hand, some patients, particularly those who cannot logistically travel, especially air travel, for the full 3-day IV treatment, would like to begin their treatment using intranasal method of exosome application. So, what exactly are exosomes? From a scientific point of view, exosomes are nanoscale, spherical, lipid, bilayered, single membrane extravesicular vesicles which act as intracellular messengers. So, in other words, think of them as very, very small, less than the size of a cell, about 1,000 times smaller than the width of a normal human hair. Um, Nanoscopic, not microscopic. Round little balls, and in this double layered ball, it contains chemicals or chemical messengers which the exosomes excrete or secrete to dictate, I guess, and inform and control the actions of the surrounding cells. These actions are primarily anti-inflammatory, immunomodulating, and tissue regenerative. In therapeutic settings, exosomes are collected from already donated healthy cells. That's where the term allogenic comes from. And these donor cells are carefully screened and then processed in sterile lab conditions, after which the collected or secreted exosomes from the stem cells are further screened and then stored in biobanking facilities ready for treatment use. So why exactly do we use exosomes, for example, in ASD? Well, not only research but clinical findings have shown that children with neurodivergence experience inflammation in the brain, and this causes an immune system imbalance. These issues can affect how the brain itself develops and communicates with itself. This route is both non-invasive and child-friendly. There's no needles, no hospital stays, so why the nose? Inside the nose, and I have quite a big nose. Inside the nose, it's fully lined with blood vessels, and of course these are quite close to the brain. In fact, really, the sinuses and the brain pan are only separated by a thin bone called the cribriform plate, which behind it is the ethmoid sieve. This special location allows these tiny nano exosomes travel directly to the brain and therefore the central nervous system. So, uh, what are parents reporting in the follow-up consultations after treatment with exosomes and stem cells? Uh, Improvements in expressive receptive language skills, reduction in repetitive behaviors. There's better sleep, better emotional regulation. We see increased social engagement. This also includes eye contact. Importantly, these are the positive signs that we see, but of course, we always have to describe and explain negative effects. So, most importantly, side effects from these allergenic treatments are clinically minimal and usually limited to only mild nasal irritation or transient changes in the sleep pattern of the patient. So, what exactly is the experience like? For most families, the procedure feels no difference to giving a child a saline or nasal spray or even an allergy medicine. Some patients or some parents prefer their own healthcare provider to administer the exosomes, although in most cases, parents do it themselves at home. The process usually takes only a couple of minutes. Of course, with any nasal spray, the nose has to be cleaned beforehand. And if there's any sinus problems or bunged up nose, blocked up noses, then nasal spray itself is usually deferred until the nasal passages are open. This is an example of the intranasal applicator that you will be provided. we usually send an additional applicator top just in case. These are MSC-derived exosomes. Now, of course, with any kind of intranasal application, the nasal passage must be clean and clear. This can be using a tissue, and the patient or child can blow their nose. Once the nasal passage is clear and there's no debris inside, we take the bottle. The bottle itself with the exosomes are stored in the fridge door, not in a deep freeze or anything like that. And once they're taken out of the fridge, all you need to do is keep it in your hand for about a minute or 2 minutes in some cases, just to warm it up to body temperature. Do not apply the intranasal applicator with the solution straight from the fridge. This will definitely irritate the sensitive membranes. Now, again, once the membranes are clear, we take the bottle, we take the cap off the bottle. Using the applicator here, as you can see, there are two places to put your hands on like that. Now, with the end of the applicator pointing into, not up, not up into the nose, not up, but into the nose like this, and then give it a good squeeze. And one on the other side as well. And once more. This is as simple as it is. It's an intranasal applicator. You must keep the nose clean afterwards. As you can see, by applying it straight up, you lose a whole lot of the fluid and it can come back down. So therefore, instead of applying it like this, at a slight angle like this, up into the intranasal passage. Applicating ready for spray. Just like that. The end of it is very narrow and tapered and soft. There's very little chance of any kind of damage. Is it safe? So far, intranasal exosome therapy has shown a strong safety profile since exosomes themselves do not contain um, cells themselves or DNA capable of reproducing or any kind of cellular glycics. The risk of rejection or serious side effects is low, almost minimal. However, as with any emergent treatment, it's important to work with qualified medical professionals and always seek therapies from reputable clinics. Reputable clinics means those who can demonstrate the origin of their cells, their exosome products. That includes certification of sterile production, health ministry approval, etc. So, what should parents know? Stay informed, always ask questions. Quality matters. Only seek treatment from reputable providers who use certified labs, transparent protocols, and they can track and demonstrate their safety data. Always ask about source and testing and ensure the donor cells are ethically sourced, pathogen free, and thoroughly tested. Thank you and good evening.